Hi, my name is Alex. I'm a nursing student, and I'm going to be talking to you a little bit about utilizing exercise to help manage stress. Now, pregnancy can be a time of high stress for women, and exercise is an important way to cope with that stress you might be experiencing. Along with being good for your body, exercise helps improve your mood and reduces depression and anxiety. Now, I know you're busy, so this video is going to show you some exercises you can use in your home without any equipment to help cope with your stress. Now, before we begin, there's a few things you need to keep in mind. Make sure to talk to your healthcare provider before starting any form of exercise to make sure it's safe and healthy for both you and your baby. If you're just starting to be physically active now, it's important to start slowly and increase your amount gradually over time. Be patient with yourself. Moderate intensity exercise, 30 minutes per day is what's recommended. This means you're working hard enough to raise your heart rate and sweat a little bit. Now, I know this sounds overwhelming at first, but keep in mind you can split this up into 3 10-minute sessions throughout the day whenever it works into your schedule. While you're pregnant, avoid doing activities that are going to have you lying flat on your back or that put you at risk of falling or any sort of belly injury.
Hi, my name is Shanna, and I'm also a nursing student. I'm going to be working with Alex today to show you exercises that you can do in 10-minute sessions when you're feeling high amounts of stress throughout your day. Keep in mind, this is not a workout video in its entirety. We're showing you exercises that you can use to create your own routine. These are the exercises that we'll be using in this video. If you're in your first trimester, to do an arm press, you're going to get into your hands and knees position. It's important to keep your back straight and in alignment. You want to make sure that you're not letting your back arch or curve down. You also want to make sure that your shoulder is in alignment with your wrist. They should be right on top of each other. This exercise is hard. So you want to make sure that you're not overexerting yourself and only lower yourself down to what is comfortable for you. Alex is going to show you that you're going to slowly and in a controlled way lower your arms and come back up. You can do this 10 times. Don't overexert yourself, like I said. If one is enough, one's a starting point, and we can continue to gradually increase. If you're beyond the first trimester, you can do this exercise in the standing position using a wall. You're going to start with your legs shoulders width apart. You're going to be facing the wall, and you're going to put your hands right out in front of you. You want to make sure that your back is straight and that everything from your shoulders to your ankles is in alignment. Now you're going to press into the wall the same way you would the ground. And then you're going to come back to the neutral position. You can do this 10 times, and you can also break it down into 2 sets of 5. You can make this exercise harder by taking a step back away from the wall and repeating this process. If you're in your first trimester, to do a gluteal raise, you're going to get in the hands and knees position. It's important to make sure that your back is straight. You want to make sure you're using your ab muscles so that your back doesn't curve in. You want to make sure your shoulders are over your wrists and that your hips align with your knees. Now to do this exercise, you're going to raise one leg so that it makes a straight line from your head to your toes. Perfect. Hold it for 3 seconds and then you can switch legs. You can repeat this exercise for 60 seconds. To make it harder, you can hold your leg up for longer. If you're beyond the first trimester, you can do this exercise in a standing position using a wall. You're going to get into position by facing the wall, feet straight pointing at the wall, about shoulders width apart. You're going to place your hands flat on the wall right in front of you. Now you're going to take a step back with one of your legs and point that toe down towards the floor. Now you're going to slowly lift the leg only as much as you're comfortable, and hold for 3 seconds. Replace the leg back on the floor, and repeat this 10 times, or as much as is comfortable for you. Then you can switch legs and do the same thing. rock exercise, you're going to get into the hands and knee position. Again, make sure your back is straight, your shoulders line up over your wrists, and your hips line up over your knees. For this exercise, you're going to draw your belly button up to the sky and arch your back. Hold this position for 5 seconds, and then come back down to the neutral position and hold this for 5 seconds. You're going to repeat this for a minute. During this exercise, it's easy to let the weight of your baby draw your back downwards. This puts a lot of strain on your body, and it's important to keep your back straight like this.
You can utilize these exercises to create your own routine that works within your daily life to manage your stress. Thanks for watching. Hi, my name is Alex. I'm a nursing student, and I'm going to be talking to you a little bit about utilizing exercise to help manage stress. Now, pregnancy can be a time of high stress for women, and exercise is an important way to cope with that stress you might be experiencing. Along with being good for your body, exercise helps improve your mood and reduces depression and anxiety. Now, I know you're busy, so this video is going to show you some exercises you can use in your home without any equipment to help cope with your stress. Now, before we begin, there's a few things you need to keep in mind. Make sure to talk to your healthcare provider before starting any form of exercise to make sure it's safe and healthy for both you and your baby. If you're just starting to be physically active now, it's important to start slowly and increase your amount gradually over time. Be patient with yourself. Moderate intensity exercise, 30 minutes per day is what's recommended. This means you're working hard enough to raise your heart rate and sweat a little bit. Now, I know this sounds overwhelming at first, but keep in mind you can split this up into 3 10-minute sessions throughout the day whenever it works into your schedule. While you're pregnant, avoid doing activities that are going to have you lying flat on your back or that put you at risk of falling or any sort of belly injury.
Hi, my name is Shanna, and I'm also a nursing student. I'm going to be working with Alex today to show you exercises that you can do in 10-minute sessions when you're feeling high amounts of stress throughout your day. Keep in mind, this is not a workout video in its entirety. We're showing you exercises that you can use to create your own routine. These are the exercises that we'll be using in this video. All right, we're going to start with shoulder rolls. So the first thing you're going to want to do is get in a standing, relaxed position. Your feet should be about shoulders width apart. And you're going to make sure you're relaxed, not locking your knees. And we're focusing on the shoulder. So starting with your right shoulder, you're going to rotate it forward, completing a circle. And you can do this 10 times. And you can switch to your left, doing it 10 times on that side. And then you can do both shoulders for 10 times. For arm circles, you're going to start by extending your arms out to your side with your palms down. You're going to make small, smooth circles with your arms going forward. You can do this about 20 times, and then you can switch to rotating your arms backwards in small, smooth circles. And do that for 20 times as well. You can make this exercise a little bit harder if you point your fingers up to the sky, or if you make your circles bigger. For the side stretch, you're going to start in a standing position. You're going to reach one arm up and stretch it across your body. You want to make sure that you're keeping your hip and your feet aligned. You don't want to overextend because this will throw your body out of alignment and can cause pain. You're going to hold this for 5 seconds, and then you're going to switch sides and hold that for 5 seconds. You can repeat these exercises for 30 to 60 seconds. Our next exercise is going to be calf stretches. Use a chair to make sure that you're balanced throughout this exercise. You're going to put your hands on the chair for stability, like Alex is showing. Then you're going to take a step back with your right leg. Keep your back leg straight, but make sure you're not locking your knee. And bend your front leg. Notice how Alex is in a straight diagonal line from her shoulders to her feet. You're going to hold this for 5 to 10 seconds, and then you're going to switch legs. You can repeat this exercise stretch for 30 to 60 seconds. Our last warm-up exercise is going to be marching in place. You're going to start in a standing, relaxed position, feet about shoulders width apart, and you're going to march in place. You should make sure that you're moving your hands with the exercise. Perfect. You can do this for 1 minute.
Thanks for watching our video. These warm-ups can be included in your exercise routine as you work to manage your stress during your pregnancy. Go ahead and go to Exercises for Stress Management Part 2 for further exercises you can be including into your daily life.
Pregnancy is a time of change in a woman's life, which can bring on positive and negative stress. Increased stress levels that are caused by negative stress can be harmful to you and to your baby. Long-term complications of stress can cause high blood pressure and heart disease. It also puts your baby at risk for a premature birth or low birth weight, which can lead to other problems later in life. It is important to develop healthy skills to cope with stress during your pregnancy, because when stress is decreased, anxiety can be reduced and feelings of well-being can improve. One way that you can manage your stress is by practicing mindfulness. Holistic Nursing, a handbook to practice, describes mindfulness as the practice of being awake and aware of one's breaths, thoughts, feelings, and sensations as they occur. When you are being mindful, you are being present in the moment, instead of thinking about all the things that have happened or might happen. For example, if you are taking a walk outside, instead of thinking about all the things you have to do after your walk, focus on the environment around you, how it feels, how it smells, the colors you are seeing, and other sensations you are having. Practicing mindfulness can be done anywhere at any time. Everyone can practice mindfulness, and it can be done in different ways. Some people like to listen to guided meditation videos, which can be found on the internet. Some like to take walks, and some will find a picture they enjoy looking at and focus on it. Your practice can take as long as you want. I recommend starting small and practicing mindfulness for about 3 minutes a day. Then with practice, increase your time daily. You can do short sessions multiple times a day, or one long session once a day. Mindfulness is very flexible and can fit into anyone's schedule. If you want to start your own mindfulness practice, remember these few things. First, be kind to yourself. It is not easy to quiet your mind and focus on the present. This will come with time and practice. Second, make your practice your own. If you would rather go on a walk than sit in a chair to practice mindfulness, that's great. Don't compare your practice to someone else's. This is your time to focus on yourself. And finally, remember to be non-judgmental to the thoughts that come to you during your practice. If thoughts come into your mind, recognize the thoughts and then push them away to focus on the present moment. I hope your practice will bring you inner peace and mental clarity to enhance your stress reduction. Please try a short 3-minute mindfulness meditation session on the next video. This is a 3-minute long mindfulness session. Let's begin. Choose an environment where you can be uninterrupted for 3 minutes. Sit in a comfortable position, whether that's on a chair, on the floor, or on a pillow. Place your hands in your lap. Try to avoid laying down because you do not want to fall asleep. You want to be in the present moment. While you are sitting, Let the thoughts in your head become quiet and keep your mind still. If a thought comes into your mind, recognize that thought and then push it away. We do not need to think about it during our practice. Focus on your breath. Try to make your breath equal in lengths when you inhale and when you exhale. Feel the air travel deep down into your body. Draw your focus to your shoulders. Notice how they feel heavy against the gravity that pulls them to the earth. Do not resist this gravity. Just let it pull on your shoulders. Feel the surface beneath you. Notice how it feels against your body, soft or firm. Focus on how your body is reacting to that surface and the sensations it brings you. Bring your focus back to your breath. This concludes our mindfulness session.
Sleep and pregnancy. What you should know. Today we will be discussing the changes pregnancy has on the body, how pregnancy may impact your sleeping and sleeping habits, and ways to maximize your sleep while pregnant. The first question I'm going to answer is, why is sleep so important during and post-pregnancy? In order for your body's immune system to function properly and protect you from harm, sleep is vital. Without a fully functioning immune system, you become more susceptible to infection and disease. A lack of sleep can also impact your body after pregnancy. This includes slowing your body's healing time, affecting your breast milk production, and putting you at an increased risk for postpartum depression. The next question I'm going to answer is, what can I do to improve my sleep during pregnancy? Number 1. It is very important to talk with your doctor before starting any over-the-counter sleep aids or herbal remedies, for some may not be safe to take during your pregnancy. Number 2. Maintain your body's internal clock. This means that you should try staying active during the day and slowing down at night for sleep. Remember, consistency is important, and you should prioritize your sleep. Number 3. Find the best sleeping position. The body changes during pregnancy can contribute to uncomfortable sleep. Increased size of abdomen, bladder pressure, back pain, and additional aches all contribute to discomfort during sleep. This makes finding a good sleeping position important. Your go-to sleeping position prior to pregnancy may not be as comfortable as your pregnancy progresses. One sleeping position to try is sleeping on side, also called SOS position. The best side to sleep is on your left side. Sleeping on your left side improves blood circulation to the heart and increases the blood flow and nutrients to the placenta and fetus. The image shown demonstrates this position. You may also try adding a pillow in between your legs for more comfort. Number 4. Preventing or alleviating heartburn. During pregnancy, the release of certain hormones and additional pressure of the growing fetus on the stomach contribute to heartburn. Some tips for preventing and alleviating heartburn include avoiding large meals before bedtime and instead eating smaller and more frequent meals during the day. It is also important to decrease the amount of acidic, fried, and spicy foods eaten. Lastly, try waiting 1 hour after eating before lying down and sleeping with your head elevated with pillows to reduce heartburn sensations. Number 5. Try to limit excess fluids before bedtime in order to decrease trips to the bathroom during the night. Still drink enough water during the day, but limit water closer to your bedtime. It is also helpful to limit caffeinated beverages such as coffee, tea, and soda to the morning and/or afternoon hours. Number 6. Add daytime naps as needed. During pregnancy, it is important to get enough sleep. Adding in naps when possible is beneficial during pregnancy, but if napping is making it harder to fall asleep at night, try limiting naps to earlier in the day. Number 7. Try finding a stress management technique. Stress keeping you awake? Sleep loss may be due to stress. In addition to everyday stress, it is common that pregnant women have fears regarding their pregnancy, birth, or becoming a parent. Perform an activity that is enjoyable to you prior to bedtime, such as reading, drawing, coloring, or journaling. Number 8. Use relaxation techniques before bed to help with relaxation and falling asleep. These techniques may include taking a bath prior to bed or drinking a warm, caffeine-free beverage such as milk. And lastly, number 9. Be sure to discuss any sleeping difficulties or concerns with your doctor. This video may serve as a guide to help you improve your sleep during pregnancy, but it is still important to discuss any sleep changes or concerns with your doctor. Now it is time to review what we have learned. Throughout this video, we discussed the importance of sleep during and after pregnancy, different ways you can maximize your sleep during pregnancy, and that it is always important to speak with your doctor regarding your sleep concerns. This concludes the sleep and pregnancy video. Thank you for watching.